that all of you know in today's time that the cancer cervix deaths are more than the pregnancy deaths. So my appeal to every gynecologist, come forward. You can make a difference. You and you only can make a difference. My flow of presentation will be like COVID-19 pandemic and its impact on health, improved awareness about the prevention in masses, which is a silver lining, why we need to prioritize HPV vaccination in case if you have to give a big fight to make India cervical cancer free. And I repeat again, it's the gynecologist and the gynecologist team can make a difference. I will focus on postpartum vaccination. I will also focus on adolescent vaccination. And I will take up questions which bother gynecologists' mind from time to time. I will give you an update of information and statistics. To the best of my knowledge, they are the latest. At the same time, I will not contradict the guidance provided by the government and the medical associations. What is the healthcare impact of COVID-19 vaccination? I don't have to say. Bachcha janta hai. Thanks to our TV media, social medias, that everybody has become a doctor. This has also brought home that there's a decrease or there's a deficiency of health resources. It also had focus on the burnt out healthcare workers because of the COVID-19 experience. And looks like it is never ending. We have to build a stamina for ourselves to fight out. It can go on for a year. It also brought home that the regular care given by a gynecologist to her patients did suffer a lot. In terms of visits, had become markedly less, so their care can never be the same. Improved awareness about prevention has become the silver lining. Without any kind of promotion, health has taken the center stage in people's life. People know if you're healthy, you're going to survive. All unhealthy people, chutney has started, they are going to go. And they've also realized that prevention is much better than cure. And the vaccine is the need and the need of the hour. People are waiting with open arms for much awaited vaccine. Now, as far as the impact of COVID pandemic on immunization is concerned, as per NFID data, COVID-19 has made vaccination rate drastically, they have decreased. If we take MMR vaccination, the drop is 50%. When it comes to DPT vaccination, the drop is 42%. And if you take HPV vaccination, the drop is 75%. WHO warns, and very rightly, that disruption of immunization services, however for brief period, has serious repercussions. The outbreak can happen, and it will have its toll on mortality and morbidity. All governments and the health bodies should be aware of the same. Now, when we wait for vaccine for COVID-19, I'm addressing majority are gynecologists and the people who are working for cervical cancer-free India. Let's protect patients from other vaccine preventable diseases for which safe and effective vaccines are available, and for we gynecologists, it is cervical cancer. As for the cervical cancer is concerned, we all know India loses 60,000 women as a result of cervical cancer deaths. We are contributing 20% to the kitty of cervical cancer globally. We are losing women vaccine is concerned is a high impact vaccine according to the Gavi. 20 deaths are averted per 1,000 vaccination. Vaccine. For every 1,000 vaccination, 20 deaths are averted. The next क्यों नहीं move हो madam? That the gynecologists have brought down maternal mortality to a large extent. And as for the cervical cancer prevention is concerned, gynecologists can really make a difference. And now the American College also feels that the gynecologists play a critical role in care, and they should assess and vaccinate adolescent girls and the young women with HPV vaccination, and they should not lose any opportunity in a catch-up period. There are 4 reasons why gynecologists should prioritize HPV vaccination. They should prioritize because the FIGO recommends it. Foxia, highest body, also recommends it. There are 40 crores of a girls and a woman are waiting to be vaccinated. And the gynecologist take care of a woman from the womb to the tomb. So they are in a priority situation. And they have the know-how that to see the case, diagnose precancerous lesion, and treat them. Because treating the precancerous lesion only brings a full stoppage of development of cervical cancer. It's the gynecologist can do it. There are 4 reasons to counsel and offer HPV vaccination to postpartum patients. In our country, the problem is the gynecologists don't see the adolescent girls when they're in schools. Giving a vaccination to them is a government priority and a government will. Unless there's a political will, things will not happen. We were promised that it will take off in 2009. times. The visits in the antenatal period, the visits in the postnatal period have become less. So your opportunity to counsel them for HPV vaccination have also been compromised to a large extent. And in-clinic consultation should not be increased. It is not for patient safety, and it is not in the safety of the doctors and her team. Teleconsultation, it is time to grab this particular technology to its full. It is going to be the new normal norm as other branches have taken over. Gynecologists should also adopt it in a very big way. At the same time, everybody can't counsel. There's a counseling technique you have to learn, and it's a learnable technique. I always say, जब आपने बोलना है ना तो कम बोलना है. It should be like elevator speeches. Talk precise, talk emotional, short, meaningful sentences, no science, talk quick, 15, 16 seconds, 2-3 sentences, talk emotional, make your message personal and emotional. I have taken it. Look, my team has taken it. Every woman working in this particular clinic has taken this vaccination. My daughter has taken it. All our relatives have taken it. You should also take. Your daughter should take. Your daughter-in-law should take. Your family members should take. That's the way we need to counsel them. Ensure that you use the right words. It is the need of today's India to prevent cervical cancer, because the deaths due to cervical cancer are much more than the pregnancy deaths. If you want to protect ourselves and benefit by it, join this particular movement. Join your hands with a gynecologist. It is going to benefit you, your family, and together we can see to it that this country can become cervical cancer-free India. Look, the others have done it. If the others can do it, Australia is on the verge of getting declared as cervical cancer-free. If those people can do it, why can't we do it? We can also do it. Avoid using words which speak science, percentage, sex, sexually transmitted diseases, and increases immunity. Don't use it. Now, coming to another big question, which bothers every gynecologist. Screening is enough for preventing cervical cancer. I vaccinate. Here I wish to remind, the Western world is using screening with 100% commitment. In the last 60 years, they've brought down the disease markedly. But when they accepted vaccination with open arms, Australia's example on the verge of getting declared, and you'll find many countries, one after other, will be declared cervical cancer free. And this is only the combination of the HPV vaccination along with the screening, which has really done the job and is the real key. I wish to remind every gynecologist, every woman of this country, this study has been done by ICMR. It is our own country study. It shows that if you just take the vaccination, the cancer load of this country can come down by 45%. Only vaccination, that's it. And if you combine this vaccination with one-time cancer screening at the age of 40 years, this will increase to 52%. And if you do the screening for 3 times and vaccination, it will be 62%. So the message is loud and clear. Vaccination is the base of the preventive pyramid. This should not be avoided. CDC is the highest body. Every country, every medical person looks up to it for advice. It says, not only rely on cervical cancer screening, but to protect women with HPV vaccination is the key to eliminating cervical cancer. Cervical cancer is the only one type of HPV cancer which has got recommended screening program. The rest of the HPV-related cancers require invasive testing and treatment. But the fact remains very clear. 90% of HPV vaccination are preventable with HPV vaccination alone. The question is often asked, Madam, postpartum vaccination की बात कर रहे हो? Isn't it too late? This slide is eye-opener. No age is exception to HPV infection. Even newborns. Take any group here. With increasing age, the incidence increases. And I'm trying to be very blunt. Every time you have sex, the new HPV virus comes. This slide shows the risk of progression of HPV infection from CIN1 to CIN3 to cancer increases with age. The risk of progression from CIN1 to CIN3 is 7 times higher for a woman over 30 years than a woman who is less than 20 years. So these couple of 2-3 slides explain everything. Quadrivalent vaccine is efficacious even in mid-adult women. Up to the age 45 years, the studies have been done. It is effective against HPV 6, 11, 16, 18 related infections and warts. 100% efficacious against LICL or worse. Another question. Do I need to vaccinate my patient if she is already positive for any HPV serotype? Very good question. And the answer is very simple. At any given time, I'm repeating it second time. A woman positive with these all 4 types of HPV, only 0.1% people are infected. It means 99.9% can be benefited. This study has been done in a sexually active woman. One group was 16 to 26. Another group was 24 to 45. There is a mistake. It is written 25. It's up to 45 years. And because 0.1% people were affected with 4 viruses at one given time, the inference of the study was that 99% women will benefit in both the groups. So majority of the sexually active women can benefit from HPV vaccination. Another question. Patients are concerned about the safety. How do we provide it? Both the vaccination, whether quadrivalent or bivalent vaccination, they have solid data of 10 years. As for the quadrivalent vaccine is concerned, there are 7 phase 3 studies covering 30,000 people. There are 15 post-license studies covering 1 million subjects. And all these big bodies, WHO, FDA, FIGO, CDC, name any big body. The safety is unquestioned. You don't have to argue. Put this particular slide in front of them and people will be satisfied. Another question. People ask, आप vaccination तो जल्दी देते हो, cancer तो आपको late में होता है, will it be effective? Yes. Again, American College of Obstetricians and Gynecologists, the CDC, the WHO recommend that it can be very safely given in a postpartum period. It is effective, it is safe, and it satisfies people. As far as the vaccination is concerned, in a postpartum period, people who are lactating, the people who are not lactating, it is safe and effective to the same extent. Now, the patients are concerned that the disease happens in the later stages of life, then does quadrivalent vaccine will be effective after so many years? Solid data of 10 years follow-up. Zero breakthrough. Whether it's a quadrivalent vaccine, whether it's a bivalent vaccine. Another question. How delayed due to lockdown? No rocket science, no big formula. All 3 doses should be given within a year period. If the vaccination schedule is interrupted, the vaccine doses do not need to be repeated. That is what to be remembered. That's all. Now, 4 reasons to choose quadrivalent vaccination. Efficacy, up to 45 years, it has been tested, undoubted. Proven effectiveness that provides long-term protection. Established evidence is there that it is safe in a postpartum period and can be given. And there, my own experience says 99% of your pregnant patients take it happily and they're happy. And they remember that they took it. And as far as large data, that it is safe because so many doses have been used. Another question. While protecting postpartum mothers, let us not miss out adolescent girls. Adolescent girls is the apt age for preventing cervical cancer. No girl should leave the school, whether in America or India, from HPV vaccination. She should be vaccinated right in the school. We gynecologists are trying to motivate the politicians, the Government of India Health Ministry. The assurance is plus, plus, plus. Let us see when it happens. So there are 4 reasons why we should vaccinate adolescent girls. One thing, higher immunity response seen during this time. Though we also know that antibody levels have nothing to do with their long-term immunity. It is also known that adolescent girls, if they have sex, they have a high risk of acquiring HPV infection, even with one single partner. Then immunizing before exposure can give highest possible efficacy. And then we also know that 9 to 14 years, the vaccinations are to be given at 0 time at the end of 6 months. So you save on the cost as far as adolescent vaccinations are concerned. Another question. In fact, now I wrap up. The effective HPV vaccination counseling and strong recommendation by the gynecologist is all it takes to protect women from cervical cancer. Thank you very much. Thank you really very much.
Thank you so much, Dr. Sharda. It was a wonderful presentation.